statin medications, is over 45 or 50 years of age, might be 20 pounds overweight. Those things in and of themselves are enough to cause neuropathy. And then you throw a disease on top of that, you know, like cancer or diabetes, and the net result is they have this health problem. Well, the most important way we can help treat patients is to best identify the cause, because you know, if somebody is consuming something that might have caused the neuropathy or has been exposed to something externally that could be causing the neuropathy, it's important to know that so it can be removed. A good example would be patients that have certain occupations that that create environmental exposures, if you will, and that you know, can cause neuropathy. So the first step is a thorough history, then a very, very detailed clinical examination, which I'm sure I'll show you when you come to the clinic.
Great.
And after that, it's really a matter of taking a look at medical records, taking a look at diagnostic studies, seeing if there are other things that need to be done to make an accurate diagnosis. And then once the diagnosis is made, if it looks like it's something that's, you know, within our realm to treat, then we go ahead and treat.
So just like any good diagnostician, you find out the underlying causes, and that's how you decide
that's
to treat
half.
the person?
You know, that really is half the battle, because you, just like in any condition, and I tell patients all the time, I want to know most especially what you don't have. And with patients that have neuropathy, that's really important, because they have a whole host of, you know, a constellation, if you will, or an entire group of symptoms. So it's very important to pull out what's what. Pull out what is neuropathy, what may not be neuropathy, what might be something else, what might be related.
Sure.
So that's, you know, kind of the thought path that we go through in the clinic.
So when somebody comes into your clinic and you're doing this workup, what have you found? You've been treating neuropathy for how many years now?
That's been since 2008.
Okay.
Yeah.
So specializing in neuropathy since 2008, and in that period of time, what do you find? What are some things that you've learned about neuropathy or along the way? You know, neuropathy or neuropathy patients.
Well, I mean, number one, it's a devastating condition. You know, I got started on this because my brother-in-law's mom was at the time 81 years old, diabetic. She was so miserable from peripheral neuropathy, Paul, she was almost suicidal. I mean, she was absolutely devastated. She had lost sensation on half her foot, had difficulty walking, and told me she hadn't slept in 4 years.
Wow.
Yeah, and so when something like that hits home, what I did is probably the same thing you would do for a patient, is you just automatically go into research mode.
Yeah.
So all I did for months was to try to find out what's out there for neuropathy, and I learned a whole lot, and that is that medically there's very, very little that can be done for neuropathy. All the pharmaceuticals, with very, very rare exception, simply mask the symptoms, because that's all the pharmaceuticals are designed to do, and that's all, from a medical perspective, we know how to do. But what I found and uncovered was very, very interesting. And what I discovered is that in some other countries, European countries in particular, Japan, for example, they've been treating patients with peripheral neuropathy for years with certain, well, let's call them nutraceuticals, or dietary supplements manufactured to the highest specifications. There was also some evidence that certain forms of nerve stimulation were very, very helpful. There's also evidence that certain forms of nerve stimulation were harmful. There was some anecdotal evidence that laser therapy, cold laser therapy, could help patients with peripheral neuropathy. So ultimately what I did is to just take all the good stuff that I could find in the literature, combine it into a treatment program, and now we have, you know, 50 centers plus around the country where we teach other chiropractic physicians, physical therapists, and even now medical physicians how to help patients with physical neuropathy, with peripheral neuropathy, not just getting rid of the physical symptoms, but also, you know, we tell patients we try to help them get their lives back.
Is there these clinics that are around the country? Is there a uniform name for all of them?
Yeah, it's all the neuropathy DR treatment centers.
Neuropathy DR treatment centers? And,
correct.
And if people wanted more information about that, is there a website?
Absolutely. Just go to neuropathdr.com.
Okay.
There's also a special website where we have the archives of a lot of information. We also have a mobile app that patients can use to get a lot more information from it. All that's referenced at beatingneuropathy.com.
Okay. Yeah, as just visiting your clinic and seeing, you know, how you care for patients was very interesting to me. One of the things that I'd like you to explain to people is when a patient comes through your clinic, they'll see a bit of this when we visit the clinic, but maybe explain a little bit about, I know some people have some concerns about chiropractic adjustments and I know that you're very gentle and that you're very cautious, but can you say a little bit more about how you adjust?
I'd be more than happy to. First of all, adjustments is the word that chiropractors commonly use for high velocity, low amplitude treatment. And if, just by definition, what that means is that an adjustment, which is a chiropractic technique, is rapid but low amplitude, meaning it's very shallow. But there's a lot of misconceptions, primarily from movies and the media and that type of thing. And you know yourself that chiropractic care, when done properly, is usually extraordinarily gentle. Now, what I discovered in peripheral neuropathy, because I've done a lot of work with physical therapy. Back in 1985, myself and a group of other very, very progressive chiropractic physicians opened one of the first multidisciplinary rehab centers. So I've worked with rehab, I've worked in rehab, I've worked with physical therapists, and now I teach physical therapists at the American College of Physical Medicine. So very, very familiar with a lot of those techniques because I teach them. And we do more of those types of techniques with neuropathy patients than anything else. It involves a lot of stretching, mobilization, techniques that help to restore tissue integrity, muscle strength, and so on and so forth. So our techniques tend to be very gentle, they tend to be extraordinarily comfortable, and they complement the other things that we do to help patients feel better. They're simply designed to help get more blood flow to the tissue, increase the circulation, and as you know, when you do that and combine it with some of the other things that we do, like laser and electrotherapy, especially the rebuilder dual frequency nerve stim, which is what we use mostly, the combination of those things together works very, very well.
Yeah, it's interesting to hear you talk about that, and of course, treating people the way I do, using acupuncture and whatnot, and it just sounds very complimentary that what we do, and that we're
absolutely
creating movement. We're using a very gentle form of stimulation.
Correct.
And that earlier you had mentioned that we kind of avoid more extreme forms of stimulation, and that we're going for more, would you say it's a lower...
Yes, and that's a really good point. That's a really good point. What I discovered when I did my research, and what I've also found in my clinic, much like yourself, is that there's what's called a dose-response relationship, and more is not better. And more is not better with chiropractic. It's not more with many drugs. It's not, not more with better with massage, for example. Having massage every day might sound good, but it's probably not really good for most people. But what we have discovered is that when we treat the body adequately, let it rest, treat it again, let it rest, it responds amazingly well. And all the supportive literature, whether we look at cold laser therapy and we look at electrotherapy, lower frequencies have a calming effect, and they have a very, very healing effect, whereas higher frequencies tend to be almost destructive sometimes.
And that's the same thing with us with acupuncture, very low amplitude. If I'm using electroacupuncture, very, very low, just very low frequency.
Exactly.
I want to thank you for coming in the
Sure.
clinic here.
My pleasure.
It was
my
great.
pleasure.
It was great having you, and I really hope people learned as much as I did just from being with you here.
Sure.
And let's go. I'd like to have everybody come along and let's go take a look at Dr. Hayes' clinic.
All right, let's go. Hi everybody, I'm Dr. John Hayes. I'm the president of Health Solutions Group here in Norwell, Massachusetts. I'd like to welcome you to my office today, and I have with me my wonderful staff. They're going to just tell you a little bit about themselves and what they do here for you.
Hi, I'm Courtney and I run the front desk.
I'm Rebecca and I run the business office.
I'm Crystal and I'm Dr. Hayes' assistant.
One of the most important first steps in getting a recovery from peripheral neuropathy or a related condition is undergoing a comprehensive evaluation. And Crystal and I in the office are the two that you would be interacting with. And basically what we would do is initially take a very thorough history. Crystal's going to ask you about things such as medication usage,